is a momentary alertness but loss of voluntary muscle movement that occurs when you are just about to fall asleep or when you are just waking up from sleep. It can last anywhere from 20 seconds to a few minutes, and it affects about 8% of the general population. Some of the common sensations and emotions associated with sleep paralysis are an awareness of your surroundings but inability to move, a sense of physical weight and pressure on the chest, difficulty breathing or a choking feeling, hallucinations or a sensed presence, and an overwhelming sense of fear or dread. Some people even describe hearing footsteps getting closer, seeing intruders, demons, or spirits, and feeling as if they are about to die.
Nightmares or night terrors, in that the brain is awake but the body is in its sleep state and thus cannot move. There are two types of sleep paralysis, hypnagogic and hypnopompic. These two terms refer to the difference in time at which sleep paralysis occurs. Hypnagogic, also known as predormital, is when sleep paralysis occurs at sleep onset or just before falling asleep. On the other hand, hypnopompic, also known as postdormital, refers to sleep paralysis that occurs just after waking up, at the transition from sleep to awakening. In order to understand how sleep paralysis occurs, we have to understand what Rem sleep is. During sleep, your brain cycles through 5 different phases: stage 1, stage 2, stage 3, stage 4, and stage 5, which is called rapid eye movement stage, or REM for short. A REM sleep cycle consists of 25% of your sleep, which may occur several times throughout the night since your sleep cycle is repeated. So, how do you avoid sleep paralysis? There are a number of factors that contribute to your likelihood of experiencing it. A twin study conducted on 862 participants showed that genetics are at least partially to blame for sleep paralysis, with researchers finding that genes accounted for 53% of the occurrence of sleep paralysis. If you have a sleep disorder, you're also most likely to experience sleep paralysis. Sleep paralysis is a common symptom of a sleeping disorder called narcolepsy, which is characterized by excessive and uncontrollable daytime sleepiness. Sleep paralysis is also most likely to occur if you sleep on your back, and if you regularly don't get enough sleep. In general, poor mental health is associated with sleep paralysis. Higher scores on self-reported measures of depressed mood and anxiety have been associated with sleep paralysis. Research focusing on sleep paralysis in patients with PTSD showed higher prevalence as well, and another study has linked bipolar disorder to sleep paralysis. As we have seen, there are a number of factors associated with sleep paralysis, like genetics, poor sleep, sleeping disorders, and poor mental wellness. Aside from avoiding or treating these specific risk factors, are there other treatments that could work for avoiding sleep paralysis? Well, there is no universal treatment that works for treating sleep paralysis. There are preventative and management strategies. However, these strategies lack empirical consensus among researchers. Some researchers have suggested that treating underlying sleep-related disorders or mental illness disorders may help with preventing occurrence of sleep paralysis, and some pharmaceutical drugs, such as antidepressants, may help in managing sleep paralysis due to their REM-suppressing properties. Additional preventative strategies for sleep paralysis include having optimal sleep hygiene, avoiding alcohol and caffeine before bed, and incorporating pre-sleep relaxation practices into your nightly routine. Although experiencing sleep paralysis can be extremely frightful, there are no immediate dangers or health risks associated with it.
Give support to me by subscribe my YouTube channel. Do check out my video and subscribe to my channel. I would like to hear your feedback.